Hey, what's up, guys? So today's probably gonna be a short video. Been a really long, exhausting, frustrating week, as I talked a little bit about it yesterday. But I'm gonna go over CMT or Charcot-Marie-Tooth Disease, if you'd want to know what it was. I've talked about it before. Talking about it again because it's definitely something most of my specialists feel I have. And yeah, I recently went to UCLA to try to find answers there because everyone out here isn't certain. I don't know how uncertain they are versus how certain they are, or they're just not sure they're equipped to handle, my case because it is, kind of complicated, which I understand. I have Ehlers-Danlos, which in itself is insane to try to work with and deal with. But then you add fibromyalgia, small fiber. Sorry, my throat's kind of giving out there. Small fiber neuropathy, and Sjogren's and just everything else, I deal with. This it's hard to tell what exactly is what. Is it a new thing? Is it a flare up from an old thing? Is it, So I get it. It's not easy. But at some point, when are they gonna just decide to try treating it? Now I get it with CMT. There isn't really much to be done. The biggest thing is physical and occupational therapy, which I quite honestly loathe. I know it's very helpful, but it's also just daunting to have to do, painful, and just all that. But I just been kind of looking up medications and just treatments and stuff. And I'm just trying to educate myself and try to inform myself to go to my current doctors and just be like, what can you do for me, and just offer any insights I have, or just have better questions to ask them, or maybe ask them, who would be best to deal with this. Should I try going to my neurologist? Would he know? I don't know. So, but among the things I've found, at least for treatments, is obviously, like I said, therapies, which is the biggest one, unfortunately. I mean, not that I want to take more medicine, but I don't want to be in pain either. I mean, I'm already dealing with more than enough, and I don't want to deal with more. It's exhausting, really is. Yeah, so with medications, right? They say most patients do well with Neurontin. I think that's how you pronounce it. The more easily pronounced name that it's called is gabapentin. And for that reason is because you can keep increasing it for the most part until it becomes, helpful in that pain department. Problem is, I'm on that. I've been on it for years. I'm on 300 milligrams 3 times a day, so 1,800 a day. I've been what my other rheumatologist said is the max, which is, oh crap, what was it? It was like, I want to say like 2,200 or something. I don't know, give or take. But I don't know if that actually is the max or if you can actually go above that. I don't know. But the fact that I'm on it, and I'm on it for fibromyalgia, right? And I've been on it, like I said, for years, and it's been helpful for the fibro for the most part. I mean, it's not actually a cure-all, but it's, significantly reduced it for me. The problem is there's other things, like Lyrica and Cymbalta. I don't know if those also help treat CMT. I would guess so, just because gabapentin does. It's of the same nature. But I would never go on those because I've already been on them. Cymbalta, I don't know. Both Cymbalta and Lyrica altered my mental state in a not good way. I could feel it. And while Lyrica literally made my body feel so much better, that mental change is not worth it. I deal with anger issues already, and that intensified it like tenfold. And I can feel it, I can sense it. Like, it's just, there's something in the pit of my stomach. I can just tell something huge was like waiting to just lash out. So that's why I stopped taking that and just went back to gabapentin and just dealt with it, So that's kind of the sucky thing. The other sucky thing is, I have a sensitivity to medications. Back when I first got treated for bipolar depression, I think I went through like 15 to 20 different antidepressants before I found one that either that worked and the side effects weren't like insane. Like, to give you an example, there was this one I took that was an antidepressant, but it also had a extra effect of anti-migraine, which I thought, okay, that's cool, not that I ever got them that often then anyways. But then, after being on it for, I don't know, a month or so, or maybe 2, I don't know, it's been a while, but I was like, it's not as effective anymore. And he's like, well, okay, let's bump it up one more notch. And as soon as we did that, like just a couple days afterwards, I started to get migraines, because that's how my body works. Oh, I'm gonna help you with migraines, gonna help you fight them? Nah, we're gonna do the opposite, bro. It's just been my experience all my life. It's always been like that. Or it's just, it's just intolerant of it. And I know everyone's body gets used to drugs, that's just how your body works, but mine always also felt like it did that also more frequently as well. So yeah, it's difficult for that reason alone, plus everything else I deal with and whatnot. But the other thing is that they were talking about like basically like Norco or hydrocodone, that type of stuff, that you can't really rely on that. Even though it's helpful, you can't rely on it because obviously it's an addictive drug, among other problems that can come with taking that on a daily basis. Plus, I really hate that medicine. I was on it for a while when I had my tonsils removed, and my brain sucks now already as it is, but it was like twice as bad when I was on that stuff. So I definitely don't need that. And the other thing is NSAIDs. And that's another problem. I just talked about sensitivity. Well, a couple of years back, I took Mobic, or meloxicam, I think is the other name for it, but Mobic. It's a prescription strength NSAID, and I took it because they wanted to see if it would help with the inflammation and stuff, and with my joints and everything. And it did help. Apparently that's when I found out my body doesn't like NSAIDs, or at least that one in particular. I mean, we didn't dare try any others, I guess. After that, basically what happened is I started getting this really bad intestinal pain and just issues with all that area after being on it for like a month. So we stopped it. And then I think it was 2 months I was on it. And then what happened actually is I didn't know this was a thing or even a possibility, but apparently it is. So what that medicine did to my internal, intestinal or digestive system is it rewired it. I used to, most people generally have a bowel movement every day. That's normal. And I used to until I was on that, until whatever that medicine did to me. And I had talked to my gastro about it, and he says, yeah, if your body hasn't gone back to normal by now, this is now your new normal. And my new normal is, on average, I go once every 4 days. That's usually my average. Now, sometimes I'll go more often than that. Sometimes a little later than 4 days, but generally it's right at four days. Which I can tell you, it makes it more painful holding all that in there. But like, I have no urge to go. I've even tried just going. I've tried things like fiber supplements and all that junk. Nothing forces it to go more than just however or whenever it decides to go. So yeah, it's unfortunate. So I don't know if I would ever want to try another NSAID anyways. And steroids aren't a good thing to take for it. It's just like there's a lot of restrictions, not just for the disease itself, but with my health and my other conditions and my sensitivities and blah 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 blah. So it's already frustrating as it is trying to get a diagnosis, which I'm almost positive, like I'm 95% positive it's going to be CMT, because I've looked at all the other musculoskeletal disorders. I've looked at all the other, nerve disorders, and yeah, it's just the one that fits the most. I have most of the symptoms, and I don't feel it's a pinched nerve because it's no longer my left hand anymore. As of a couple of weeks ago, my right hand exponentially, sadly, has been getting just as bad as my left. Now, thankfully, I haven't noticed any muscle loss yet, but what I have noticed is that same elbow nerve pain that shoots up to my hand, the muscle pain, and in fact today especially has been really rough because the muscle that goes along your ulnar nerve area, the bottom of your arm, essentially. Sorry about that. This muscle right here, all of like, I don't know, 5 hours now, has been hurting, and it's been causing these two fingers to do exactly this, to basically stay in this position. I can force it out, but then it's painful. And if I just let it go in, it's not as bad. But if I put any pressure on it, like if I put it on my my little armrest, that little bit of pressure triggers it even more and causes more pain and that more cramping and seizing. And it sucks. It's like I feel like it's progressing, whatever it is. I'm just gonna say whatever it is. I don't really know, but wherever it is going on, it's feeling like it's starting to progress even further and faster because it's been like 14 months since I first started losing muscle in my left hand, and it's actually lost more muscle since that first time. It's had more pain and all this other stuff since then, but it's been, like I said, over a course of like 14 months. This has been over a course of 2 or 3 weeks, so that's kind of scary and nerve-wracking, and the fact that I can't find anyone to understand it or name it and help me slow it down or control it or whatever you want to say about it. And it concerns me because it's like, everyone knows they use their hands and arms for so many things, but you literally don't understand the scope, the depth of how truly important they are until that's taken away from you. Just the fact that my left hand is so weak from all the loss of muscle is just, it's detrimental. I can't open a jar of anything with my left hand. It's just ridiculous. I have to use assistive devices or have somebody else open it. And it's just, they're used for everything. And so it's just frustrating and upsetting and actually painful, to say the least. But yeah, so I'm just like, I don't know. I'm just really exhausted at this point. Mentally and physically, it's just so much. But I'm just, like I said, I'm trying to come up with a game plan. I'm gonna talk to my pain specialist and ask, hey, what can I talk to the UCLA doctor? What can I say to him to help him out and understand and come to a conclusion? Or in case the insurance doesn't want to help out and pay for tests, or if he just doesn't pan out because he's just too old and not knowledgeable in the new stuff or whatever it might be, I need a backup plan. Who can I go to then that will just be like, okay, well, we can say that it's probably an autoimmune or blah 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 blah, and let's just start treating it. Who should I go to for that? Should I go to the previous hand surgeon that's out here? Should I go to the neurologist? Should I go to the rheumatologist? Should I go to the physio? All the above, them, pain specialist, I don't know. I just know I need somebody to help me in any regard. So I'm just trying to get game plans and backup plans and just be kind of brush up on this stuff so that I can maybe help them or help me help them, and just kind of not caught off guard with questions or them not understanding stuff, and so I can explain things better and whatnot. So it's a process, and just doing this to mostly to help myself, obviously, but also to try to keep myself busy and focused on more positive things, and so I'm just that is keeping me busy and whatnot, and so I'm just doing what I can to keep me busy, keep me occupied, keep me motivated, and not self-loathing and all that junk, because it's not going to help me. So yeah, that's the funness that's been going on. But yeah, so hopefully time will tell. I'm really hoping that UCLA will pan out. I guess we'll see. I don't know how long it's going to be till I hear back from them about the nerve study they want to do themselves. So, anytime I get information on that, obviously you guys will be updated and whatnot. So yeah, so I'm gonna end that here. I appreciate you guys watching and any comments that you guys leave, and you're welcome to comment and question, and if you have any advice as well, please feel free to drop a comment. And so yeah, I appreciate you guys. I love you guys, and I hope you guys have a good week, rest of your weekend, and hopefully a good week. Talk to you later.